Hi guys, I'm back at Aesthetica today with Dr. Calvert, and we're here to talk about all things rhinoplasty. Hi, Dr. Calvert.
How you doing?
Can you tell us a little bit about yourself?
Well, I'm Dr. Calvert, and I'm a plastic surgeon from Beverly Hills, California. And I come to Dubai about 3-4 times a year and do a lot of rhinoplasty while I'm here.
So tell us, in 2019, what is the trend for rhinoplasty?
For the last decade or so, it's been structural rhinoplasty. This is the concept of doing your reduction, if it's to make the nose smaller or to make the nose larger. You're actually holding the structure over time by grafting the nose with cartilage from your own septum, your own material. It's very reliable, you get great results that last, and all these revisions that you hear about that are time dependent are starting to go away.
And do you perform closed rhinoplasties or open rhinoplasties?
So open rhinoplasty is the concept that you make a tiny cut in the columella and flip the skin of the nose up like you're opening the hood of a car. Closed rhinoplasty is that you don't open the skin, you actually do the incisions inside the nose and you elevate the skin through internal incisions. And so I think you can do closed rhinoplasty, I think you can do open, but really it's about customization of the operation to the patient. For me, I like to have all the techniques at my disposal and I do what's going to give the best result.
So speaking of best result, how does one pick their rhinoplasty surgeon?
The best way to find a rhinoplasty surgeon is to look at the before and afters. But I think it's really about evaluating the gallery of results as a whole. And so look for a surgeon that's got loads of results on their website. Look for somebody that you can talk to their patients. And it's all about the look that surgeon creates. And so it's all about that surgeon's aesthetic eye, and that's how you pick. You look, you see somebody, oh my God, my friend had her nose done, it's beautiful, I love it. Then go to that surgeon because you'll be happy if that's what you love. And it is about seeing the results and seeing the patients that they've done, and then being comfortable in the consultation that you really feel that this surgeon can do you right. Because it is a connection, it's a team effort. It's not just, I'm gonna lay back and get a great nose. There's work to be done on both sides.
And does price matter?
Price definitely matters. You start to realize that you're kind of gonna get what you pay for. And you don't really learn how good your surgeon is until things aren't right and when there's a problem. Because what you're really paying for is for the surgeon to be able to take care of problems if they come up. So you want to go someplace where you really feel like this surgeon's going to take care of me. If things aren't right, he's going to step up and do the right thing. And that's not the case. I mean, I hear horror stories all the time about surgeons saying, well, that's the best you get, because you paid $5,000, $6,000 for the surgery and they're done, it's over. Well, if you want a revision, you got to pay me $5,000, $6,000 and do it again.
So in terms of rhinoplasty, what's the pain factor? What's the recovery like? Just walk us a little bit through that.
The recovery is variable. Some patients need a lot of internal work, and that can cause more swelling than if you just need a little bump taken off and maybe some tip work. If you're having the septum worked on in the airway, the swelling can be much greater and can take longer to heal. And everybody heals differently. The rhinoplasty that I do starts off like a potato and doesn't look great. And 3 weeks after, you want to go get new headshots for your acting career or whatever you're doing. And I said, well, wait a second. I know it looks good at 3 weeks, but it's still really swollen. Give it 3-4 months because it's going to take time. That's the hard part because patients want, I had rhinoplasty, it's over. I want an instant result. That is not reality. That's not how it works. It's surgery and it takes time. Only rhinoplasty you can get instant results is if you do a liquid rhinoplasty where you fill the nose, make it bigger to hide bumps and lumps. So with surgery, you have to be patient.
Okay. Well, great. Thank you, Dr. J, for all the helpful information. I hope we answered all your questions about rhinoplasty. Dr. J is here visiting from Beverly Hills, so get in touch for your appointment.